You should put my fake implants in.
Oh, yeah.
See if anyone comments.
No. See whose are bigger.
All right. Hi, guys. Good morning.
Good morning. So I'm Dr. Leong, and I've got Fran here with me. She's our Coolsculpting expert. I don't know if you guys remember, but about a month ago, we did a little, how do you say it? Kind of like a little back and forth between liposuction and Coolsculpting. And then Fran actually went and had some lipo done. So we're here doing our follow-up at about a month, and I just wanted to have her share a little bit about her experience, her expectations, her recovery, her results, and whether or not she would recommend this to friends and family. So, and then we'll do a little show, and Chelsea's gonna post the before photos so you can have something for comparison.
Yes.
All right, Fran, all you. Just kidding. She is very nervous, so if you guys have questions, just shoot them forward. Okay, so Fran actually had lipo a long time ago.
About 7 years ago.
Okay, and were you happy with the results then?
No. So one of my flanks was actually really curved in, and one of them was like flat. So I kind of had like a really hourglass side and then a flat, chunky side.
And what did you do with your lovely devices to try to fix that?
Well, so I Coolsculpted this whole half before, and this side trying to get it in, but it was more, I guess, more skin and harder to really curve it in there. I couldn't really get a detailed side on this area, but more so on to match this side with the applicators that I have. So.
How many times did you try to correct it?
About 3.
Okay. And did you see any result?
Minimal, just because I couldn't get the applicator quite in because I should be smaller framed, but at the time I was not. I was larger. So it wouldn't really hook on the way I needed it to for me to get the actual curvature that I needed.
Okay. That's actually pretty interesting, because I think a lot of times people are like, just get this, but we're kind of
limited with applicators.
Right, because there's only one size or a couple of sizes that need to fit all body types. Okay, so then if you saw yourself as a client, what would you have recommended for yourself?
Liposuction, for sure.
Okay.
Yeah.
And why? So I think a lot of people come in and they say, hey, I want Coolsculpting, and then we talk to them about both, and it's not always clear why they should do one versus the other.
Right. So Coolsculpting is more for like small pockets of fat. Being, in school full time and stuff, I gained quite a few pounds, if you saw in my before photos. And Coolsculpting, it would have taken me, just to get my abdomen down, probably 4 or 5 sessions, and that's just to get like probably half of what Dr. Leong did with lipo. So.
Okay, so we went ahead and did lipo, and if you look back, I think we posted that experience. Fran was kind enough to be very open with it. And so now we just want to ask about when you woke up from surgery, how the anesthesia was, how you felt going home, and then kind of what your experience was over the next couple of days, like that first week.
Well, after anesthesia, I woke up, I felt fine. Dr. Eric is amazing. She's awesome. I woke up, I felt good. I didn't even need my pain meds, honestly. The next day I came to work.
She did.
I did. I just love you guys so much.
We told her to stay home, but she came in anyways.
Yeah. Doctor's orders.
And then we sent her home, and then she came back the next day anyways.
Yes. So honestly, I think the worst part about lipo is just so in the lipo incision holes, the first like 24, 48 hours, you have like leakage coming from whatever Dr. Leong puts in and then sucks out. So that's the worst. I did okay, I'm gonna say it. I did wear.
It's a great idea.
It is, actually. We should brand that. Mm-hmm. I did wear like an adult diaper just to hold in, like, so when the fluid would come out, and it was easier than just constantly putting in like pads or things just so it doesn't leak through. It was actually comfortable. Other than that, the pain is minimal. Like, I'm still a little sore when I move to the sides because she's very aggressive. Looks little, but she's vicious. Yeah, other than that, it was just, I felt like kind of like stiff after you get off like a really shaky roller coaster, or you're just kind of like you know, you sleep a little funny one night, but nothing that you, honestly, if you do like desk work or something, you'd be totally fine. But running around at work, I got a little winded the first few days, but after that.
And she would notice over the course of the day that
the swelling.
Yep, she was skinny in the morning and then
puffy at night.
Puffy at night, yep.
Which is fine. Totally worth it.
Takes some time for that lymphatic to kind of work its way out because I've disrupted it with the cannulas. It does always come back, but the swelling can last. I mean, even at a month out, you're noticing that there's still swelling.
By the end of the day, I get a little swollen, so.
Yeah. Part of what we do here at the office, too, for these liposuction patients is Lisa, our esthetician, she does lymphatic massage. So that just really focuses on areas that are especially swollen, or if there are any areas that we're like, you know what, we need a little more compression or a little more work on this area, she can push that fluid out. Mm-hmm. And people, after they have the treatments, like immediately they feel softer, they feel better. So we like to build that in with our liposuction and with my BBLs and such things. Mm-hmm. Okay, one thing that Fran mentioned was the drainage, and just so we are all on the same page with that, when we do liposuction and make little incisions, they're kind of like the size of my pinky finger.
I can show him one.
Well, Fran can show you one as it heals, and we leave those open. His idea is I'm putting in a lot of fluid as part of my technique for the liposuction, and I suck all that back out, but then as your body heals, it makes fluid too. So I don't want that fluid to collect in pockets underneath the skin as we're trying to get it to heal down nice and smooth and tight. So we leave it open, and over the first day or two, you will notice, I tell people it looks like Kool-Aid. You're not bleeding, it's Kool-Aid, it's normal, it's okay, but it will all come out. So the adult diaper thing that Fran did was actually brilliant, because we've been telling people to get sticky maxi pads and putting them up against their undergarments, but you still go through a lot of pairs of underwear, you're doing lots of laundry, and that's the last thing you want to do when you're trying to recover the first 48 hours. Okay, so I know Fran had kind of been sharing with me and with social media too, kind of her progression of recovery and when her results and whatnot. So when did you think you noticed a difference after?
Oh my gosh, on day 4, my stomach was night and day different. It went from like really pulley to almost like completely flat. Like, it was awesome. The bruising, like, it looked scary, but the bruising didn't hurt. It was more like she got literally I have nothing left on my sides, like, at all. She went down to like bone. So, which is
there was a lot of work on Fran. Let me tell you, all that Coolsculpting, if you're thinking between lipo and Coolsculpting, please do me a favor and just do the lipo, because when it's soft and fluffy and nice, it just comes right out. But when people like Fran are like, Coolsculpt, 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 for me, it's like busting through concrete with something blunt, and it's a lot of work, and I needed like an energy drink halfway through, and someone had to blot the sweat off my face. It was work! Not that I mind, because I love treating fans. Okay, so what about wearing the binder and the girdle? As I know, there's a couple times when I'm like, Fran, where's your girdle? And you're like, I wear it at night.
I do. So during the day, especially if I'm like working and I'm Coolsculpting and I'm doing like inner thighs and I'm up and down, it's a little uncomfortable for me to wear it, especially if I have patients back to back, which I normally do. So that's hard. But when I have like on a Tuesday or, you know, when we have clinic days and stuff and I'm just walking around, it's totally easy. The binder's not uncomfortable. It's a little harder to like maneuver through things and like get up and down and, you know. But usually I'm just running back and forth during clinic, so I can wear it during. That's why I brought it today.
Yeah. Actually, can we show them your girdle, your binder? So she got one that's oh, where did you? You're not wearing it?
Oh, it's over here. I took it off.
So we put you in a binder, which is basically just a stretchy elastic band with Velcro. Fran went and got one that's a little bit an upgraded version, which is almost like a waist trainer.
It was like $10.
Yeah. So.
It just does this, and then you take. Where's the other one?
This one.
Oh, yeah. And then you just boop.
Yeah. So you can see how tiny that gets her. But that just gives compression. So we always want to do compression where we've done the liposuction. 1, to help with the swelling, and then 2, so that the skin flap heals down nice and flat and smooth, and we don't get the kind of wrinkling and rippling and indentations.
Right.
All right.
So then I can just wear it. My hair's stuck in it.
Yeah, she's basically at that stage when she can transition off of that. If it feels better, I always say keep wearing it if it feels better. But usually at a month, we have you go to like a Spanx type garment, something that's compressive but not quite so rigid and confined as the girdle and binder. And that's just for another couple of weeks. Most people feel supported when they're wearing something because they're used to having that, and it actually takes a little encouragement for them to get out of the Spanx entirely. But then we do want you at some point to be able to slip on your little dress or, you know, whatever you're thinking of wearing that you've been wanting to wear but couldn't because of your fluffy bits, and go and enjoy yourself. So I guess last question for Fran, would you recommend this to friends, to family? Would you do it again yourself?
Oh, 100%. I think a bunch of my friends have already had it. So, you know, it's the best thing ever. It's worth it. It makes you feel better. It's hard to lose weight, and, you know, if you get that little extra motivation, it's just that push.
Okay, that being said, it's not a weight loss technique. No. I never promised that. You do lose some because I am removing volume, but I think of it more kind of like Coolsculpting Extreme. It's for contouring, it's for inches.
Yes.
So.
Well, I think I'm only down maybe a pound.
Yeah.
But my pants fit better. They're actually loose. So.
Yeah.
I'm happy about that one. When they were being hair tied together, you know, a month and a half ago.
All right, that's all I have. Anything else you want to add?
No. That's awesome.
So we'll post some pictures from before and from her recovery in case you didn't get to see them earlier.
Thank you.
Bye.
Bye.